Hello, and how are you? My name is Winnie-Barawa, and welcome to our session on health needs of school-going children. And if you're new here, this is a YouTube channel that we host lessons, lectures pertaining to healthcare. And if you are interested in such, go ahead, click on our subscribe button and join the family to enjoy more classes and lessons. And remember to click also on the notification button so that you can be notified in case we post the next lessons. And so we've been hosting this class on school health, and therefore today we're going to check the health needs of the school going children. There are many, but we will focus on the key that we know contributes a lot into their learning and into promoting their teaching environment. So the first one that is very key for any child is good nutrition. And for good nutrition, we are looking at aspect of diversity in meals. And if you have been thinking around nutrition, we also have a video on this that was hosted with Winnie Moimet on the nutrition facts or dietary facts pertaining children and more so women and generally also as an adult. So you can go ahead and check on that video. I will post it on the I'll link it on the timeline before so that you can watch. But again, let's go back to the good nutrition for school going children. So children who are going to school needs good nutrition. And for this, we are looking at promotion of good menus that are balanced, containing all the food diversity that are required, that is proteins, vitamins, carbohydrates, and so on. And for these menus, most of the time we are advised they need to be developed through the guidance of dietitians or nutritionists. It's also good for children to promote good dietary behaviors, like, for example, eating the right amount, eating the right contents, and even having enough rest to allow food to be digested properly. Hand washing and hygiene before preparation, and so on. So, good nutrition, very key for any school going child. The other part is hygiene and sanitation. And why is it key? Hygiene, though, is many practices. It can include grooming, brushing, proper cleaning and tidying of their clothing. And with the hygiene and sanitation, it's key because it will promote the student from getting any sources of infection or getting any exposure to illnesses that are promoted by hygiene and sanitation. And for this, we can look at personal hygiene, and that is the aspect of their total body cleanliness from all the way from the head to toe. So it is proper to enhance personal practices among our children, like teeth brushing, getting to clean up after using the toilet, or hand washing before meals and after meals, and being able to keep neat, not only in their clothes, but also generally how they carry or conduct themselves while they are also playing. And the other part is access to safe water. We know that water is key and important for the child hydration. It promotes physiological balance in the body, including the homeostasis, digestion, blood flow, and so organ functions and all that. So safe water is good for children because you need to allow access to clean tap water, proper chlorination practices in the system so that children can be safe and you can be able to kill any microorganism before the water is taken. And for this, these are key areas that children have to be provided for, from nutrition, sanitation to water access. And so you need to appreciate too that in some schools there's lack of clean water. And if you're a parent, then you can maybe develop the habit of allowing your child to have some water bottles to carry on into school if you're not sure of the cleanliness of the water in their schools. The other need is freedom from infections, and infections can vary. You could have respiratory infections, but you could also have STIs and HIV and AIDS infections. And for this, it is key also that we teach our school-going children about how to prevent themselves from infections. We can also do this by ensuring proper treatment and medication. We can ensure that we also have proper preventive approaches like immunizing our children who are going to school, deworming, and all those sorts. The other part is safe environment and structure. And with this, we are approaching it from the aspect of buildings, and we need to inspect the school buildings and be sure that the structures are safe enough and they're free from accident, free from injuries. How can you check on the school buildings on such? You can look at if the school has stairs. You can look at the state of the rails. Are they safe enough to ensure that students might not fall in case they're walking through? Look at the classroom. Are they congested? Look at the windows. Are they aerated enough to ensure that students have enough air supply while they're studying in the school? So all these are setups that needs to be checked on. Look at the access windows and doors. Do they provide safe exits in case of fire breakouts? Do they provide or are they even large enough that students can run out without congesting onto each other or bumping into one another? There's also security factors. Do they have CCTVs to monitor the movements of the students? Do they have monitoring system in case of fire outbreaks? Are they even having security provision enough to protect them from attacks and invasions? So all these are environmental and structural systems that schools need to check through and ensure that students are safe. Environment also is not looking at physical, it can also be emotional. For instance, you can look at the policies. Are the policies child friendly? Is a child going to feel safe in the hands of the teachers? Is the curriculum adjustable enough that it is providing enough rest for the students? Other aspect of safety in schools could be in the content that is being taught. Is the content traumatizing? All these are aspects that form part of our environment for students, both physical, social, psychological, and so on. All that pertains to the environment of the school. Keeping on, school going children needs mental stability and psychological care. And for this, we need to ensure the student is free from fatigue, cared for, loved, having enough good sleep, having enough rest, getting guidance and counseling, and being taken care emotionally. So all these needs in our school going children are all helping in promoting mental stability and psychological stability, because for a child to understand, for a child to grasp what is being taught, we need to ensure that their mental status is stable enough, they have clarity of thoughts, they have good processing of information. And if mental stability is lacking, then you find this is where the child starts uh, manifesting poor or low academic performance, or they have poor social behaviors, because you need to ensure the psychology of the child or of the student is well met or is well surrounded with a friendly environment for them to grow and to mature enough to be able to sit in class and concentrate. And lastly is medical care. And medical care is looking at different aspects pertaining to early detection and diagnosis of illnesses, disabilities, and even treatment and referral system. So each school, for example, needs to have, let's say, the school clinic that can cater for early treatment and detection of illnesses for the children. And for this purpose, schools are advised to have, for example, a school nurse or a school physician who can check up on the students in case they're manifesting with signs and symptoms of illnesses. The school also needs referral system. This includes contacts or channels where they can refer a child in case they complicate with symptoms while in school. It will also be providing a school that is free from risk uh, risky aspects or factors or causes, e.g., alcohol and substance abuse, bullying, and so on. So, with medical care, it's quite broad. Some schools are very good because they're able to even provide insurance that caters for their children in case they're sick. Some students have partnered with the health facilities who come annually to just do annual screening and medical checkup on their students. Some schools have put in place first aid kits that ensures that student can be taken care of in case of emergency and on and so on. So with the school, with the health needs, you can see they're very broad. Mental stability, medical care, nutrition, hygiene, safety, all these are health needs that students need to be catered for while they're going to school. These are and again, like I say, if this is your area of interest, kindly remember to subscribe, comment, give us a like on our videos, share with your community, but more so comment on what you feel as we can discuss more on. Thank you very much and see you in our next class. My name is Winnie Barawa.